Art is her life. The opening of the Galerie unterm Arm in Potsdam fulfilled a lifelong dream of Traudl Bauscher. She gets inspired by her contact with artists and art lovers. She is in the prime of her life. She selects artists. She organizes exhibitions. However, during the production of one of the largest shows, she noticed the first signs of a serious disease.
All the symptoms
that you can call exact symptoms of this disease, I've ignored because I thought this is my private situation. So, for example, I had a slightly bloated belly. I also had a change in my bowel movements and regular constipation. I had never before had problems with it. There were all the symptoms, but I didn't pay attention to them as I thought that this is my private life.
Das ist meine private Situation.
Nearly 7,500 women alone in Germany get ovarian cancer every year. Ovarian cancer today is the 7th most common cancer disease among women. Ovarian cancer is also called a silent tumor because no symptoms appear for a very long time. Such symptoms as abdominal pain, increased abdominal girth due to ascites production, which cannot be processed by the body, or general pain are often signs of a late stage of the tumor. The ovaries are one of the female reproductive organs. During the childbearing age, an egg is released there once a month, and it passes through the fallopian tube into the uterus. In addition, the ovaries are where the female sex hormones estrogen and progesterone are produced. Cancer occurs when healthy cells degenerate. Those cells divide uncontrollably and form a swelling, which is also called a tumor. In the case of ovarian cancer, the tumor cells initially grow in the ovary. If the tumor is larger, it can spread to other organs and structures, for example, to the peritoneum. Traudl Bauscher was diagnosed with the ovarian cancer at an advanced stage. Therefore, she was immediately transferred to the Charité Berlin, the Center for Ovarian Cancer Treatment. The extensive examination showed that the tumor had already broken through the walls of the ovary and had spread into her abdomen. After the diagnosis, surgery is the next step. This involves not only the removal of the tumor, but much more. The surgery itself is the most important prognostic factor in the treatment. The less of the tumor that remains after the surgery, the better the overall prognosis and the effect of chemotherapy. We try to do everything to remove all visible tumors, around 300 tumor nodules. The operation can take 4 to 5 hours. So to ensure that no more possible residual cancer remains in the abdomen, not only the ovary itself, but also the fallopian tubes and uterus are removed during the surgery. If needed, the hormones that the ovaries normally produce are replaced with pills. Often some lymph nodes and parts of the peritoneum have to be removed as they are often attacked by tumor cells. In order to choose the exact treatment strategy and to provide the most precise prognosis in ovarian cancer, the extent of disease is classified according to the so-called FIGO stages. Stage 1 occurs when only one ovary and no other organ, such as lymph nodes, is affected. If the cancer infects one or both ovaries and spreads in the pelvis, one speaks of stage 2. The FIGO stage 3 means that the tumor has already spread, metastasized outside the so-called small pelvis. For example, if there are metastases in the liver capsule, in the diaphragm, or in the lymph nodes. If the tumor has already distant metastases, like the metastases in other organs, such as liver or lungs, it is classified as stage 4. Patients with ovarian cancer are usually diagnosed at an advanced stage 3 or 4. After the tumor is extensively removed, further therapy is discussed. There are many conditions such as individual medical history, mental strength, and physical basic constitution that must be taken into consideration. The majority of patients with ovarian cancer require subsequent medication against cancer because of cells that could not be seen during the operation and which are only microscopically detectable. It is recommended to undergo chemotherapy for a period of 4 to 6 weeks with a maximum of 8. The chemotherapy drugs are usually given directly into the blood, though they may be also taken as pills. The active ingredient has to kill tumor cells or slow down growth. For this, the drug must focus on these cells, which have to vary as much as possible from other healthy cells. Cancer cells multiply very quickly. That is a good indicator for the chemotherapeutic agents. But there are other non-cancer cells that also rapidly divide. For example, intestinal and bone marrow cells, where the chemotherapy may cause diarrhea or anemia. The chemotherapy can also find some scattered cells and render them harmless. That is why chemotherapy is so important. As Traudl Bauscher had just completed the chemotherapy, she received bad news again in 2012. Her sister is diagnosed with breast cancer in both breasts.
Also wir kamen auf die Idee des Testes, ob es in der Familie liegt, weil wenn also 3
We came up with the idea of the test to see whether it runs in the family since we have 3 cases. The hospital wanted to undertake research for scientific purposes because of the fact that my mother died of breast cancer at the age of 81, and now I have the ovarian cancer and my sister breast cancer. The clinic has suggested that we agree to the tests. My sister and I agreed.
Das deutet darauf hin und haben den Test von sich aus angeboten, die Klinik. Und ja, war meine Schwester einverstanden und ich eben auch.
Traudl Bauscher has her blood examined. She wants to know whether she has a BRCA mutation. For 10 to 15% of patients, the disease has a genetic background, an inherited mutation in the so-called BRCA genes. Ovarian cancer can therefore be inherited. The result of the test: both Traudl Bauscher and her sister have mutated BRCA genes. For Traudl Bauscher, the important question now is whether her daughter is affected by the genetic modification.
Also nachdem ich mich dann mehr damit beschäftigt habe, habe ich auch daran gedacht, ob meine...
So after I learned more about the subject, I thought if there's a chance that my children could inherit this mutation. What does it mean for me and my children? And the feelings it has engendered, of course, not scary, but more frustrating when you know you could have this gene and therefore the possibility of hurting your own children. And they have no chance to do anything about it.
Und die haben keine Chance, was gegen tun zu können. Und aber weiter habe ich mir dann auch keine Gedanken drüber gemacht.
The daughter of Traudl Bauscher, Anna Grombal, initially did not want to take the BRCA test. Years later, she deals again with the topic. She is looking at a counseling center in Berlin, the BRCA network. The advantage for women who do this test is simply that they have the certainty of either belonging to a high-risk family or not. And they enter a prevention program which is very intense. In this program, there is a MRI with a contrast medium once a year, and it helps to find cancer in much earlier stages. And you can even undergo prophylactic surgery. From the age of 40 years, it is recommended to remove ovaries and also the intensive control of the breast, and possibly also prophylactic surgery. Anna Grombal is happy that she found the BRCA network a place where she can ask all her questions. So she learns that carriers of BRCA mutation frequently get breast and ovary cancer and also frequently before the age of 50. Therefore, such families are called high-risk families. The gene mutation can pass to offspring through both mother and father. The risk is about 50% that mothers or fathers with mutated BRCA genes transmit it to their children. At the end, Anna Grombal has decided to make the BRCA gene test. The idea that it could possibly benefit her was convincing.
Nein, ich habe nach wie vor keine Angst.
Just as before, I don't have any fears at all. Depending on the results, it gives me no nightmares. Let me say it this way. For me, it was a big decision to know if I have the mutation, and if that is the case, to examine myself more intensely. And if I don't have the mutation, then to do a regular cancer screening with my gynecologist and to be happy about the fact that my children may not have a big chance to have it. After completion of chemotherapy, Traudl Bauscher began the follow-up. Her tumor markers are regularly and closely checked and to see whether they have metastasized or whether tumor cells have returned. In ovarian cancer, it is not rare that the tumors return. This is called recurrence. Shortly after the positive test result in 2012, Traudl Bauscher gets the news that the ovarian cancer has come back.
Mir hat Professor Sehuli gesagt, dass dieses Rezidiv...
Professor Sehuli told me that if the recurrence happens once, it will always come back. So now I am terminally ill. But we can make it for a while. He was very honest. I want to know this because I have a lot of things to do, so I need to know the real state of my health.
Es wissen, denn ich habe so viel zu regeln. Ich muss wissen, wie der Stand meiner Gesundheit ist.
Once again, Traudl had chemotherapy, but this time with other medication. At the end of 2013, new metastases were detected. Today, Traudl Bauscher spends a lot of the time in the hospital and goes through various chemotherapies. But now the mutation in her BRCA genes proved to be an opportunity for Traudl Bauscher. New therapeutic approaches are being explored for the treatment of ovarian cancer that patients with BRCA genetic mutations can get. This is due to the specific mode of action of these so-called PARP inhibitors. In general chemotherapy, both healthy cells as well as cancer cells are attacked. Chemotherapy can lead to problems with the DNA. It causes cell damage that leads to the destruction of the tumor cell as well as healthy cells. A healthy DNA has an intact double helix that is the basis for a healthy life. However, if cells are damaged, a tumor can arise. Then the DNA spiral wall can break frequently. These damages are repaired with the help of an endogenous enzyme called PARP. If the effect of the enzyme PARP is suppressed by a PARP inhibitor, it comes to fractures in both DNA spiral walls. Usually, there's an endogenous repair system. A special tool, the homologous recombination, repairs healthy cells as well as cancer cells. However, if there is a BRCA gene's mutation in a cell, then this type of the body's own repair system does not work anymore. The damage to the DNA cannot be repaired. The result is that the cell itself elicits its own death and the tumor cell is destroyed. Unlike Traudl Bauscher, there are also patients whose blood tests did not identify mutations in the BRCA genes, but nevertheless the tumor cells have mutated BRCA genes. This gene mutation is then caused by the tumor itself. This has nothing to do with the heredity in the family. This mutation can be detected with the help of a tissue examination, for example, right after surgery.
Bei der Diskussion zum BRCA Gentest müssen wir
At the discussion of the possibility of the BRCA gene test, we have to clearly distinguish between the woman with ovarian cancer and who would like to have this knowledge to choose the appropriate treatment strategy, and family members who are healthy but who still have a risk in itself to get breast and or ovarian cancer. In this case, we choose the prevention. Here it is important to figure out if we can avoid the breast or ovarian cancer through preventive operations.
kann ich den Brustkrebs oder den Eierstockkrebs durch vorbeugende Operation beispielsweise vermeiden.
The treatment with PARP inhibitors is oral. The duration and volume of subsequent therapy is to be determined by the physician and the patient. To start with this treatment, the patient must also fulfill certain health prerequisites. Professor Sehouli discusses it in detail with his patient.
Okay, dann sind wir genau in der Situation jetzt.
We
wo
are
sich
now
jetzt
at the point where you have recovered and we'll see if you can continue with further therapy.
Schauen, dass wir mit der Anschlusstherapie weitermachen können und dass sich die weißen Blutkörperchen, diese Leukozyten und auch die Blutplättchen, die Thrombozyten erholt haben. Auch die Nierenwerte sind exzellent.
Blood values are good, kidney values are excellent.
Ja, meine Frage ist auch, ob es auch Auswirkungen hat, so wie die
My question is whether it has an impact on the numbness of the fingertips and toes and on hair loss.
und Haarausfall zum Beispiel auch.
Da kann ich Ihnen erfreulicherweise mitteilen, dass das
Regular consultation with the attending physician at each new therapy is recommended in order to avoid the side effects or interactions in the first period. An oral intake can be a decisive advantage because it eases the daily routine of the patient. You can concentrate on the really important things in life again, but still, of course, have to remember to maintain the regular intake, the regular dosages.
Wir kennen uns jetzt seit über 5 Jahren, haben immer wieder
We have
Diskussionen.
known each other for over 5 years. We always have discussions about what you're doing at the reappearance of this ovarian cancer-threatening disease. She's now in a very positive state, has recovered well. But we know that the risk that the tumor comes back is 100%. Now, for the first time, I can work on the damage that the chemotherapy has caused, maybe control the tumor, and that way that the patient does not constantly need to go to the hospital or to the doctor.
Wenn ich in die Klinik, in die Praxis muss.
Ja, ich komme nur gerade heraus.
I've just come from Professor Sehouli and I'm enjoying a very positive result. And I just think that 5 years ago, the prognosis was very dramatic.
5 Jahren. Und wenn ich
And when I look at myself today, I think it will go even better.